The process with CE Mark is a much more open and somewhat, dare I say, collaborative process. So you actually hire your reviewer, if you will, which is interesting. You might think that's a conflict of interest. It isn't necessarily, and it's because the regulations of the CE process kind of keep that in check. So what it ends up is it increases efficiency. A very important thing is selecting who you're going to be working with. And this changes every year. I've worked with pretty much every competent authority out there, BSI, TUV, NSAI. In this case, we chose NSAI out of Ireland, and it was because we took an immediate snapshot, and the way I did that was just talking with people in the field. How are things going with this one versus that? What's the process like? And at that point, NSAI had a leg up, in my opinion, because it was a bit more interactive, the process. Less mystery is always good, and they ended up being exactly that. In our case, it was a 2-month process. We sent in something immediately. They were sending us emails like, what do you mean by this, and do you have that? And we were supplying stuff, and we actually did something that was really important, in my opinion, and that was met face-to-face with them, which often you don't do and they don't invite you to do. But there were enough questions about how the device worked that we really said, hey, listen, the best way to do this is for us to just show up, operate a few devices, we'll tear a couple apart, you'll understand it a lot better than a lot of these drawings and things going back. I mean, we had 162 parts, there were a lot of drawings. Actually, at the time, our head of regulatory they had an office in New Hampshire, sat down, deployed a device. We had a device completely blown up and sort of showing them how the parts worked and everything. And I think that facilitated the process quite a bit. I'd say that the sort of mechanical device testing and implant sort of in vivo testing, that was fairly straightforward. There weren't a lot of surprises there. We were able to build up that battery of testing, and there were some tweaks here and there with the reports, but one way or another, we had sort of built the evidence required. Clinical was a bit grayer. So the clinical review team kind of floated a few trial balloons of, well, what about longer term data? What about this and that? And we had a strong effort to respond well to those, such that, no, that's not required, here's why. In Europe, we actually were classified, it's a class 2B level. It's not class 3, even though it's an implant. Because it was viewed more along the lines of a surgical-based implant, like a staple or a suture and that sort of thing, more of a commonplace implant, not as much a prosthetic and that sort of thing. What they're looking for is, does your device perform as intended? That's kind of the key way they look at it, and certainly we had enough data and enough follow-up to show that it indeed performed as was intended. We definitely bobbed and weaved and made sure there were some fires that were lit where it was like, we have to get a response. And our goal was, if we got a question, to get a response back the next day. So there were some long nights to make sure that we got all the data packaged together. But we felt like we would take care of our side of the timeline in an aggressive way, and in a way set a tone. So we would hope that by them being impressed that, wow, we got all this together over that time, that, gee, they wouldn't just sit on it for 2 weeks and not read it, So we kind of established this working relationship where I hope, and I like to think that it sort of accelerated their process as well.